Hi, I'm Dr. Asaad Samra. I'm a board-certified plastic surgeon at Bayshore Community Hospital. I'm also the medical director of the Center for Wound Healing.
Hi, I'm Rachel Weiss. I'm the Senior Manager of Operations at Bayshore Community Hospital.
We're here today in front of the Center for Wound Healing, which just opened this past August. Here we offer the latest advancements in wound care, including hyperbaric oxygen therapy. Rachel and I are going to take you on a tour today of our facility to see what patients can expect as they come through. So Rachel, welcome to our center. As patients come in, they'll be greeted by our staff, and then they'll have a seat here in our waiting room.
And is there any special preparation they should take or important things to bring with them?
Absolutely. They should bring a list of medications or any allergies that they should have. If they have any x-rays, they should bring them. Any medical records that really pertain to their wound, they should bring with them, as that'll help us as the physicians figure out what we need to do for them.
If a patient wants to bring along a family member or a friend for support, is that okay?
Absolutely. I actually very strongly encourage that, as it's always good to have another set of eyes and ears in the room with them.
Great. Okay, good. Can we go take a look at one of the treatment rooms?
Come on in. So Rachel, this is one of our patient rooms. This is where our physicians will meet with the patients on a weekly basis and take care of the wound care.
Okay, you want to tell me a little bit about the treatment in one of these rooms?
Absolutely. So we have several physicians on our panel, and our panel basically is comprised of plastic surgeons like myself, general surgery, as well as podiatry. Patients will be connected with a physician either based upon where their wound is, what insurance they have, or potentially what day of the week they can be seen.
One of our new services is hyperbaric oxygen therapy. Can you talk a little bit about how that works?
Absolutely. Hyperbaric oxygen, or HPO, is new to our center, and we're really excited about that. What it is a pressurized oxygen treatment for complicated wounds. Essentially, a patient will get into a chamber, we pressurize that chamber with oxygen. As patients breathe in that oxygen, it forces that oxygen into their bloodstream to increase the amount of oxygen that's actually flowing through their bloodstream. That helps wounds heal faster. Not all wounds heal faster with hyperbaric oxygen therapy, though, and so it's up to the wound care experts to really determine who's an appropriate candidate and who isn't.
Can we go take a look at one of the hyperbaric chambers?
Absolutely. Let's go take a look. So here's our new chamber room, which is the newest addition to the wound care center.
So Dr. Samra, tell me what a patient can expect while they're receiving treatment.
So our patients will come in, they'll get changed out in the room that we were in before, and then when they come in, they get checked in by our hyperbaric tech. This is the actual chamber itself, and patients will go in. Essentially, this slides out for them, and then as this slides out, which is as so, the patients then can get into the stretcher, lay down, get comfortable, and get back in. Eventually, they'll get locked in, and once they're locked in, that'll allow us to put the oxygen on and increase the pressure. The typical treatment is about 2 hours, sometimes 90 minutes, sometimes 2 hours, but most of the time it's about 2 hours. The patients will have a variation in that treatment based upon the wound that they have.
Given that the patient is inside the chamber for a considerable period of time, are there any things that you can do to make the patient more comfortable and relaxed?
Absolutely. The hyperbaric technician will be constantly communicating with them. They can hear one another as this is not soundproof, I guess it's pressure proof, if you will, but it's not soundproof, so that they can communicate. The patients are here for about 2 hours. So it's typically 20 to 30 treatments that someone will receive, again, depending upon where their wound is or what their specific needs are. So it's about a 4 to 6 week process, as we typically do treatments every day, 5 days a week.
And when a patient completes their treatment plan, what happens next?
During the program, they're getting weekly wound care visits in addition to the hyperbaric care.
Okay.
If their wound has healed, and hopefully it has healed during their hyperbaric treatments, then they're done. They get their diploma and they graduate. Otherwise, they will just transition back to their weekly wound care visits with their physician.
If a patient wants to make an appointment, what's the best way for them to access the center?
They can, of course, stop by and ask any of the associates. They could call us at 732-497-1611, or they could visit us on the web at www.bayshorehospital.org/wound.